My name is Sofya Wool. I'm a pediatric physical therapist and owner of Wool Physical Therapy. Diagnoses that I treat are torticollis, milestone developmental delay, any neurological or genetic disorders that cause a child to have any gross motor delay or musculoskeletal problems. So the first interaction is parents contact me and we schedule an initial evaluation during which I collect the child's history, the mother's prenatal history, anything that can help me understand why a child may be delayed or have problems in their balance or coordination or reason for why they're not able to keep up with their peers. We do an examination of their gross motor, so looking at their balance, coordination, strength, which helps me determine percentage of their delay and how severe their condition may be. And from that on, we create an exercise program. So the first few sessions, depending on the child's age, I really like to get to know the child and what toys they like to play with, their interests, their favorite things to do. And through play and through fun activities, we end up building therapeutic exercises. I usually like to see them until they reach one of their big milestones, either crawling or walking, just to make sure that postural-wise and coordination-wise, they're at their appropriate age in terms of function, depending on when the child starts. So sometimes it can be 10 sessions, it could be 3 months of therapy, but I usually like to see my patients for at least 6 months. From experience, I learned that 6 months is usually a good duration of time for physical therapy, where we can clearly see results and clearly understand if a child may need more therapy or if they're ready to graduate. So I come to the house, I treat the child in his or her natural environment. I also encourage parent participation, so parents tend to sit in on my sessions. I create a very effective home exercise program, so we really do become a team with the family in order to promote our common goal of getting the child to where they need to be. I loved learning about the human body when I was in college, and after going to PT school and being very interested in treating neurological conditions, a job in pediatric physical therapy kind of fell into my lap. I absolutely loved working with children. It's very dear to my heart and my soul. And I fell in love with working with children. And a lot of my knowledge of neurology, of orthopedics has been extremely useful in creating proper exercise programs for these children. When parents are not sure about starting physical therapy, I always encourage them to at least schedule a consultation or do an evaluation just so we can determine if there is delay, if there's specific need for therapy, or we can just create a home exercise program and parents can handle some of these exercises themselves. And then they can touch base with me in 3 to 6 months to see if a child then does require assistance of a physical therapist. And if a mother or a father sees anything concerning that has to do with their balance, how they're moving on the playground, how they're playing with their peers, if they're noticing something concerning, it's always good to get that checked out. We want our children to be confident and able and love physical activities. My name is Sofya Wool, and I'm a pediatric physical therapist and owner of Wool Physical Therapy.